Hi, for this portion of the video, we'll be assessing Matt's lungs and also his thorax. First thing we want to do as providers is do an inspection. We want to look, listen, and feel, palpate. While we're looking at the chest wall, we want to make sure that there's normal rise and fall on the chest, making sure that the rate and depth is normal, it's adequate. The color, the contour, and also the texture should all be within normal limits. Obviously, we want to pay attention if there's pectus excavatum or pectus carinatum, which is either the inward or the outward of the sternum, and also if there's kyphosis, which is a humpback. If the patient looks to have a round barrel chest, that also gives note that they may have COPD, or also scoliosis, which is the S-shaped spine. Sometimes these symptoms and the way they present can also influence the way they may breathe. Now that we've got that out of the way, we want to feel and palpate. So palpating on the chest wall, we want to feel the vibration and making sure that it feels equal on both sides when we palpate. We also want to pay attention to make sure if there's any masses or making sure if there's any tenderness that would warrant further investigation. After we palpate, we could also do tactile firmness, which is using the palmar aspect of our hand and having the patient say 99. As I strike, say 99.
99. 99. 99. 99. 99.
Good. And so with that, we want to make sure that we feel the vibration and it's equal on both sides. After doing this aspect, I like to listen. Breath in. Out. And we want to compare left to right, side by side, making sure what we hear on one side is heard on the other. Okay, arms to your side. And go down just a little bit, breathe in. And this way we're getting the lateral portion of the thorax. Making sure there's no adventitious signs. And also this is a great way of assessing and auscultating the right lower lobe. At this point in time, we want to look at symmetry. As I place my thumbs here, I'm going to have you breathe in. Deep breath in and out. Deep breath in. As we're doing this, while the chest wall rises, we want to make sure that both thumbs are aligned equal. Okay, we can put this up right there. All right, now we'll move on to the posterior portion of the thorax. Same thing while we're back here. We want to inspect, we want to look, we want to make sure if there's kyphosis, which is a humpback, or the scoliosis I had mentioned earlier, and we want to feel for any lesions, any masses. Does any of this hurt?
No.
We also want to look at the color, making sure that everything is appropriate to ethnicity. All right. And at this point in time, I'm going to go ahead and listen. Okay, as you take a deep breath, right? Listen. And now, we want to have about 60 seconds per field, measuring from left to right, and then down, right to left. It's nice and clear. Okay. Good. You know, for a smoker, your lungs sound good.
That's not nice.
All right. So we want to pay attention if there's any wheezing, bronchi, or rales. Those are signs, adventitious signs that there's lung disease. At this point in time, we'll do tactile firmness, which is striking the back and feeling the vibrations. As I strike, say 99.
99. 99. 99. 99. 99. 99.
Say again.
99. 99.
Good.
99.
Good. And there's also a technique to see if there's consolation or compromise in the lung fields called egophony. While I'm listening, I'll have the patient say E, and if it sounds like an A, that means there's possible pneumonia or consolation in his lungs. So as I listen, Matt, go ahead and whisper, say E.
Okay. E. 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 E.
Good.
E.
Okay, and lastly, the whispering test too. I'm going to have you whisper 1, 2, 3.
Okay.
And should not hear anything. Are you saying it?
Yeah.
Yeah, good. Okay. Good, and I did not hear it. If I were to hear it, that would mean that there's consolation or possible pneumonia or pleural effusion. Let's see. So we listened, we felt, and looked at chest expansion, and it looks like that's it.